Good evening, my dear students. Today we are discussing about spirometry. In spirometry, tidal volume and vital capacity. So, what is the spirometry? What is the tidal volume? What is the vital capacity? What is the significance of tidal volume and vital capacity? Now we discuss. So, what is the spirometry? The spirometry is one of the equipment. It is the operator. It is a operator. It is the apparatus. It is the apparatus used to what it is a apparatus used to measurement of the volume of air exchange. It is to used to measurement of air exchange, measurement of volume of air exchange air exchange air exchanged during breathing. During the breathing, it is the measurement of the volume of air exchange. How much of air is exchange in the lungs? How much of air exchange in the lungs? That's one is measured by the spirometer. Measured by the spirometer. Its study about spirometer is known as a spirometry. So it is record the next one. It is a record the it is a record the data of air exchange. So the record the data air exchange by the spirogram. So the spirogram is a record the data of air exchange. The spirogram is one of the part of the spirometer. The study about the spirometer is known as a spirometry. The spirometer is a measurement of the volume of air exchange in the lungs is known as a spirometer. So the spirometry is the study about the inhalation and exhalation. Inhalation and exhalation. Inhalation and exhalation. What is the inhalation? It is a upward deflection. And the next one, what is the exhalation? It is a downward deflection. This is called as a spirometry, and introduction about the spirometry. And the spirometry is the measurement of the volume of the air exchange. So what is the healthy adult average breaths? What is the healthy adult average breaths? So average breath means respiratory rate. Respiratory rate is a respiratory rate of is a 12 breaths per minute. So what is the healthy adult breaths rate? Is a 12 breaths per minute. So the next one, what is the tidal volume? Next topic is the tidal volume. The 12 breaths per minute is detected by the spirometry and recorded by the spirogram. So it is known as a spirometry. This is about the spirometry and spirometer. So the spirometer also detect the individual characters also. Tidal value, vital capacity, respiratory rate also detected by the spirometry. So first, tidal value. What is the tidal value definition? Amount of air inhaled or exhaled in and out of the lungs. So amount of air inhaled and exhaled. Inhaled and exhaled in and out of the lungs only. Out of the lungs. At the out of the lungs, the amount of air inhaled and exhaled is known as a tidal volume. So the tidal volume, what is the normal range of the tidal value? Normal values of the tidal volume in males and females have the both normal range is the same. So 500 ml per breath. 500 ml per a breath. One breath it containing the 500 ml of tidal volume is 500 ml of inhaled exhaled air is presented in the out of the lungs. So it is the normal value for the male and female normal value of the tidal volume is 500 ml per a breath. So the next one, in a minute ventilation, next point is a minute ventilation. Minute ventilation. What is the minute ventilation? The total tidal volume of air inhaled, exhaled each minute. So it is the total tidal volume. The total volume. The total volume of air. The total volume of air per minute. Simple word. The total volume of air per minute is known as a minute ventilation. So in here, how to calculate it of this particular particular minute ventilation. So minute ventilation mv minus mv is equal to vt plus r by r. Vt plus r by r. What is the vt? Vt means tidal volume. What is the r by r? Per how many breaths? So first mv is equal to vt is how much of vt? 500 ml. 500 ml per a breath. 500 ml into RR. How much of RR is 12 into 12. So totally 6 liters. Total 6 liter per minute. 6 liter volume of air is extended in a per minute in our body is known as a tidal volume and minute ventilation. So in this tidal volume, in the 6 liters, 70% and divided into 70% and 30%. The 70% of the tidal volume, tidal volume, it reaches the respiratory portion. So what is the tidal volume? Normal range is 500 ml. In the 500 ml, 350 ml into 350 ml plus 150 ml. So 30% means 350 ml of tidal volume reaches to the respiratory portion of the system. Respiratory portion of the system. Exam respiratory portion, nothing like bronchioles, alveolar ducts, alveolar sacs, alveoli. Bronchioles, alveolar ducts, alveolar sacs and alveoli. So it is the respiratory portion. And remaining 30% is a non-respiratory system pathways. So some 70% reaches to the respiratory system pathways like a bronchioles, alveolar ducts, alveolar sacs, alveoli, and 30% is the reaches to the non-respiratory system pathways. So this is about tidal volume. The tidal volume, like what is the non-respiratory systems like a nose, pharynx, larynx, trachea, bronchi, and etc. These are 30% is presented in the non-respiratory system pathway. 70% reaches to the respiratory system pathway. So the respiratory system and non-respiratory system is a total the study about the tidal volume. So what is the tidal volume? Amount of air inhaled or exhaled in and out of the lungs is known as the tidal volume. The tidal volume is the normal value is 500 ml for breath in male and females. So the next one, the tidal volume, what is the minute ventilation? This is a total volume of air per minute is known as a minute ventilation. The minute ventilation is detected depends upon the RR and VT. So in the 70% of the VT reaches to the respiratory circulatory system, and the remaining portion is the reaches to the non-respiratory circulatory system. So this is about tidal volume. And the next one part is the vital capacity. Vital capacity. What is the vital capacity? Maximum volume one can exchange in the respiratory cycle. So it is called as a VC. Maximum volume one can exchange in a respiratory cycle, in a respiratory cycle. Maximum volume of air is the exchange in the respiratory cycle is known as a vital capacity, is known as a vital capacity. So in this some of the vital capacity, how to calculate the vital capacity, some of the inspiratory reserve volume, sum of means inspiratory reserve volume plus inspiratory reserve volume plus tidal volume tidal volume and expiratory reserve volume, expiratory expiratory reserve volume. So what expiratory reserve volume, and in here, so what is the vital capacity? It is the maximum range of the maximum exchange of the air in a respiratory cycle is known as a vital capacity. Vital capacity is calculated by the inspiratory IRV and VT EVR. So what is the IRV, inspiratory reserve volume? What is the inspiratory reserve volume? First, what is the inspiratory reserve volume? The inspiratory reserve volume means amount of air that can be forcefully inspired over above the normal inspiration. So this is the amount of, what is the IRV? So put subsiding IRV. What is the IRV? Amount of air that can be forcefully inspired. Forceful inspired over and above normal inspiration. Above normal inspiration. So he is known as a IRV. So amount of air that forcefully inspired, and a maximum amount of air is entering into the lungs is known as a IRV. What is the ERV? What is the ERV? The amount of air that can be forcefully exhaled. So forcefully, the amount of air that forcefully exhaled after normal exhalation is known as a ERV. So the sum of the IRV VT plus ERV is known as a vital capacity, So the vital capacity, depends upon the vital capacity calculation. The total lung volume is calculated depends upon the vital capacity. So what is the normal values of the vital capacity? What is the normal values of the vital capacity? In male and female, both are different. The vital capacity in male is 4,800 ml. 4,800 ml. In female is the 3,600 ml. 3,600 ml is known as a vital capacity normal values. So the vital capacity factors residue on the vital capacity. What is the factors and what is the significance? So factors that residue or reduce factors that reduce vital capacity. So first one is the loss of the distensible tissue. And the loss of distensible tissue, and these are example for the pneumonocentrepy and athalatosis is examples. And the next one is decreased complaints decreased complaints and increase the residual volume increase the residual volume and the next one then limit the thoracic expansion. And the next one is the fifth one is a limited diaphragmatic descent. Diaphragmatic descent and nerve or muscle dysfunction. Nerve and muscle dysfunction. So these are the factors affecting on the vital capacity. This is about our topic. If you have any doubts, tomorrow we will discuss.